is we can't actually use lube in their airway. It'll make it break down really quick, and then we'll have to get new ones, and they're really expensive, so we can't do that. But we are going to pretend as if we have. I haven't even opened this up yet. All right. So, first step is to gather all the equipment that's necessary to be able to do this procedure. Would you mind grabbing that ammo bag for me? Thank you very much. Okay, so we're going to gather all of our equipment. We have the suction tubing. This is suction tubing A. This is suction tubing B. This one's really small, isn't it? This is just going to connect the suction canister to the suction device itself. Okay? That way we can get the negative pressure that's generated from this bad boy into this. All right? So we need the suction device or regulator, the canister, this small pink suction tubing, the big suction tubing, and a suction canister holder. Okay? I'm going to gather all this. I'm going to get my sterile suction supplies, my sterile lube, and I'm going to get my ambu bag or non-ring breather. Okay? I'm going to have all of that ready to, because I'm going to be told by the nurse, hey, or by the doc or anybody else, hey, I think this patient needs suction. So I'm going to get everything together and then go into the room. Okay? I'm going to set all that down, and then I'm going to wash my hands. I'm going to make sure that I'm nice and clean. I'm going to say, hey, what's up, Jeanette? I'm Nick. I'm your respiratory therapist. Your nurse said that you might need suction. Do you care if I do an assessment to see if you'd benefit from that? Yeah, okay. All right, cool. So I'm going to immediately look at the patient's monitor and see their blood pressure, see their heart rate, see their oxygen level, or SpO2, and check whatever oxygen setting that they're currently on. And I'm going to document all of that either on a piece of paper next to me, or I'm going to chart it in the chart before I actually begin the procedure. Okay, so we've established that the patient needs this therapy by listening to the patient's lungs and hearing rhonchi or coarse crackles, okay, or coarse rails, however you want to say it. Patient is going to need this. Okay, cool. So now I got all my stuff. I need to assemble it before I do anything with the patient or start to get a sterile feel. Okay, so what I'm going to do is I'm going to take my canister holder and slide it right in here. Super easy. I'm going to take my regulator and plug it in, and it has the same type of backing as our air and our oxygen. This will only fit into one thing. It won't fit into the air. It won't fit into the oxygen. It has that post system that we learned about earlier in the semester. It'll only fit into one of these outlets. So I'll attach it to the vacuum. All right. Now I'm going to take my suction canister and drop it in. Super easy. Now I have to connect our suction canister to our regulator. So it's just one post right here. And if you forget which one of these, there's three little holes right here, or posts that I can attach it to. It's always the middle one, but it's also labeled that says vacuum. Okay, so I'm going to pop that off, and I'm going to attach to the vacuum. All right, so far, so good, right? Not too difficult. I'm going to take the other suction tubing, and I'm going to attach it to the post. There's two posts, and they both say patient. Okay, I'm going to attach it to one that says patient, and this is going to go to the patient. Now, I still need to make sure that this is set properly, and I still need to hyperoxygenate the patient. We're going to do the test for this first, and then we're going to connect the oxygen and get ready to set the patient up, okay? So I'm going to turn the regulator on, okay? Now you can automatically hear that noise. Right now, it says 120. Is that good? Can we call it a day? Or do we have to check it? How do we check it?
Pinch it.
We're going to pinch it. If you're ever with somebody and they go, okay, it's set to 120, we're good. Without including it, you have to remind them. I don't care if you're with the therapist. and you're doing clinicals, if they don't check it, make sure that they do. Okay? It's the super easiest thing to do. Just occlude it. We went from 120 to 160. Okay? You might think that you're set properly because it says 120. But as soon as we occluded it, we're now at 160, and that is way too high. So if it's way too high, we're just going to turn it to decrease it while still having it occluded. Okay, so that we can get a proper reading. All right, now we're at 140. That's right in range. Cool. That part's set up. I am not ready to actually suction the patient yet. Okay, I still have I have to get my sterile stuff going on, and I have to hyperoxygenate the patient. So most people need 2 hands to attach to the flow meter. So before I even get into my sterile field, I am going to attach to the oxygen and start to have this at least pretty much ready. Turn this guy. All right. Okay. So that's still sterile. This is all set up. I'm still looking at the monitor to make sure that I have at least noted in my head, patient's heart rate is 80, patient's oxygen is 96 on 2 liters nasal cannula, because hopefully you have more than 1 oxygen output, and we do here, but I just didn't plug the other one in for showing this. Okay, so I am going to make sure that I maintain a sterile field. That hand's sterile. This hand's sterile. This guy is still sterile. Okay? So now I can touch this, and like I said, I like to make this a little bit more malleable. Okay, that should be good. And I'm going to take this sterile catheter, and we're always going to pretend in here, okay? Because like I said, we can't put this, the lube actually into the mannequin because it causes breakdown really quick. So I'm going to add some lube there. And I'm going to make that decision on which hand is going to be clean and which hand is going to be sterile. I'm right-handy, so this is going to be sterile. This is going to be clean. I'm going to go ahead and take my suction tubing. This hand is no longer sterile, it's just clean. I'm going to take this suction tubing and apply it to the suction catheter. Okay? So, this guy, all still sterile. This guy, just clean. I can go ahead. I don't have to bag them. If they're tubed, I can bag them. But I'm going to apply 100% oxygen for 30 to 60 seconds. Okay, 30 to 60 seconds. That is 30 seconds. Okay, so now, maintain control. Go ahead and introduce into the nair. And again, if you hit any resistance, either back up just a little bit, or you can do a little twisty. Oh, there's some resistance. There we go. All right, and then you're gonna advance until you get him to simulate his cough. All right, and now I'm gonna use my clean hand to maintain control over the intermittent suction port, and I'm going to slowly withdraw. Okay, if you hit a pocket of sputum, then you can apply it there for a second. Okay, and then keep on moving it out. Total suction time should take no longer than 10 to 15 seconds. Once I have withdrawn all the way, I'm going to allow the patient to recover. Okay, I can allow the patient to recover one of 2 ways. Either just letting him be like that and see what his oxygen level is, or I can maintain as sterile of a field as possible with this hand. My clean hand can then go ahead and grab the oxygen, apply oxygen for another 30 to 60 seconds, and then do the procedure again. Okay? Maintaining that same type of sterile control that you did the initial time. The entire time that you are doing this, you have to be monitoring the patient's heart rate. Okay? If we see a change in heart rate of greater than 20, we have to terminate this procedure immediately, re-hyperoxygenate them, watch them recover, put them back on their previous settings, and document that there was an adverse reaction. Okay? We are also, if the patient doesn't have an adverse reaction, we are still going to document what we did. Okay? We're going to say, I was able to, like, NT suction the patient without adverse effects, obtained small amount of thick yellow secretions, or obtained copious amounts of pale yellow secretions, obtained blood-tinged sputum. Whatever it is, whatever you're viewing, that's what you're going to document. When you're done suctioning, though, you are going to remove that suction catheter from the suction tubing, and you can either whip it into the trash can. You're not actually going to do that. You're gonna drop it in the trash can, or you can wrap it up in your gloves and throw it away in that way. Okay. Other people have also found that it's very beneficial to prepare the glove or prepare holding in a certain way. When we get it out of the wrapper, it's like this. We're sterile right now, okay? Both hands are still sterile. To maintain control, you can put the catheter right here into your palm, and then you're going to wrap that around your hand. Okay? So now it's not just whipping out there like this, hoping that it doesn't touch you. Okay? If you do this, you can maintain that sterile catheter around your sterile glove without it whipping around and having the opportunity to hit your clothes, hit your arm, hit the bed, or anything like that. It is, me personally, I generally don't do it because I've done it for 15 years. I'm pretty quick and pretty much know how it moves, okay? But what I'd recommend for you guys is to take that sterile glove after you get your sterile field and just hold it in place like that, and you're going to wrap it around your hand, and you'll be able to keep this nice and sterile and protected and controlled. Okay? Sound good? Okay. Once you're finished, again, you're going to remove everything. You're going to put the patient back, after you've hyperoxygenated the patient again, you're going to put the patient back on their previous settings. You're going to document their vitals again, so their blood pressure, their heart rate, their oxygen level, put them back on their previous oxygen setting, clean your hands, and go back to lunch. Okay? All right, so